Good morning. My name is Christian Frazier, and I'm here with Dr. Auerbach at the Marijuana Doctor, and we want to talk to you today about cannabis and the medical benefits of cannabis. So, Doctor, here at the Marijuana Doctor, tell us actually what you do here.
Yes, I'm a certifying physician, meaning a certain number of physicians in the state have applied to get their certificate to be able to recommend marijuana. So I did that about 4 years ago, and I've been doing this ever since.
I also saw that online that you just had like 5,000 reviews online at the Marijuana Doctor, which is amazing. Mm-hmm. So you've been, going through a lot of patients here, and Florida is the largest medical marijuana industry or market in the country right now.
Yeah, it's truly busy. This company has over 20 locations throughout the state, so the reviews, I'm sure, encompass all various offices, not just one. But from what I've seen, all the physicians and all the staff are very dedicated to this role of making people more comfortable with medical marijuana, and so far we've seen tremendous results.
Amazing. So, there's a couple of questions that people have about medical marijuana. Like, what are some of the medical benefits that people are using medical marijuana for?
Right, there's a host of benefits. Just in my own background, I was an oncologist or a cancer doctor for about 30 years in the Tampa area, and all during my time, many patients would smoke marijuana, illegally, of course. But with my okay, even though it wasn't legal, because it helps so much with pain, the side effects of chemotherapy like nausea and vomiting, and it really improves the quality of life. Other than oncology patients, which make up a good percent of patients we see, we also see patients with a variety of illnesses, from chronic pain, chronic anxiety, other psychological disorders. There's a limited number of state-approved diagnoses, but the state has been very good about letting us judiciously use other diagnoses that are similar to the ones that they have, such as Parkinson's or cancer or ALS, any number of medical conditions, including inflammatory bowel disease such as Crohn's, which is more common than you'd think once you realize how many patients come in to get the benefits of marijuana from the various dispensaries.
Yeah, my neighbor actually has Crohn's disease, and not only do they use it for consumption, but they have also made suppositories with the oil that has provided a lot of relief.
Yeah, people have done that, but what most people don't understand is that some of the dispensaries make suppositories, so if people want to make their own, that's wonderful, but if they want them to be professionally made, there are at least 2 or 3 dispensaries in Florida that we know of that have suppositories in stock, or they can get them very quickly. It's certainly not the most chosen route, but in certain circumstances it really is beneficial.
Makes sense. It makes sense. So one of the questions that my audience has is that, are there any side effects that someone can experience from medical marijuana?
Yeah, it depends. There's always some effects, good and bad. If you have an older person who's never really used marijuana or hasn't used it since high school, which we hear that all the time, I haven't used it since I was 18 and now they're 73, that you can have side effects. Other than getting high, which is pleasant to some people, but for a lot of older people, very unpleasant because they feel that they're losing control. So that can be a bad side effect. Smoking too much, which mostly younger people do, can lead, that's for sure, that can lead to an issue called cannabis hyperemesis syndrome, where if you use too much, you end up in the emergency room with severe abdominal pain, nausea, and vomiting. And if they don't ask or you don't tell that you've used a lot of marijuana, they'll do CAT scans. People have gone to surgery to look for perforated bowel, etc., because they're so sick, or obstructed bowel. So it's a dangerous syndrome. Not so much that you're gonna succumb to the syndrome, it's just you're gonna succumb to the medical care that you might get, which is totally unnecessary. So we try to teach people when they come in, limit it. There's like a bell-shaped curve. Not enough doesn't work. A perfect amount is great. Too much doesn't work and it causes a lot of side effects. There's a lot of people out there, sadly, that can't control their intake of products, and in those cases, I always feel better if they have a responsible adult who lives with them, who can at least monitor things so they don't overdo it. It's not easier said than done, though.
I understand. Mm-hmm. And it's very rare that I actually have heard cases of people actually going to the hospital, but it does happen, especially with edibles.
Yes, we've had several patients end up in the hospital, and they've told us about it, and now the emergency room staff, including physicians, is thinking about it. And I'm just talking about Florida, where I live. I'm sure in California and Colorado, they've thought about it for decades, but now that it's so common, meaning the use of marijuana in Florida, there's a lot more cases than you'd think. I know personally some emergency room doctors that see it relatively regularly.
So it's really recommended when you are first starting out to microdose and also kind of monitor and figure out what is the right dosage for you personally without overdoing it. So you definitely want to start out with smaller amounts, see how it feels, try it out, and then you can determine what's going to be the right dosage for you personally.
I agree with that 100%. And some of our patients, I'd say maybe 20%, have never used marijuana, and that's perfect for them. Start low and increase the dose slowly. They always say that when we take courses. Start low, increase slowly. And then we have a lot of patients that are heavy users of marijuana now, and whether they'll want to change their type of consumption or the amount that they consume, is you can tell them that, but sometimes they do, I'm sure, and sometimes they don't. But the bottom line is, I'm not trying to be negative about the side effects, although some are negative. It's an extremely helpful product for many patients with medical conditions.
Yeah, I consider myself to be a heavy user, and one of the things that I have to do is I switch up, methods. Like I'll do edibles, I'll have oil, I'll have flour, I'll mix it up so that it actually works for me, and I find doing that really works, switching up different types of methods of consumption.
You're absolutely right, and as most patients know, but maybe not the watchers of this, the way you use it affects how quickly you feel it and how long the benefits or the side effects last. If you smoke or vape it, it gets into the bloodstream just like oxygen does through the little blood vessels in the lungs, and it's almost an immediate effect, usually a good effect. If you take it by mouth, there's something called first pass metabolism, where if it goes through the liver, actually the THC is converted to another related product, so the actual THC that's in the product gets converted, and that has a longer half-life, meaning it lasts longer in the system. So people who have trouble staying asleep all night find it's very beneficial to take a product an hour before they go to sleep. Then it kicks in usually, and they get a nice 6 or 7 hours of sleep. Whereas with smoking, everyone's different, of course, but you might go to sleep real quickly and then need to repeat that in a few hours. Not everyone, but some patients.
That actually happens to me.
Sure.
Like I'll go to sleep, and then for a few hours, I'll wake up in the middle of the night, do it again, sleep for another 3 or 4 hours. But I do find out when I do consume edibles, especially the ratio, the 1-to-1 with CBD and THC, that it allows me to sleep for like a good solid 6 to 7 hours.
That's exactly what we see in our offices with our patients.
Great. So let me see. This is a common question that a lot of people have because we're seeing it on the market a lot now. Delta 8. What is your experience?
Yeah.
Explain to our audience what Delta 8 is.
Well, Delta 8 is a different, I'm not a chemist, but it's a different variant of marijuana. It's not the same as the Delta 9, obviously. And for some reason, it's allowed to be sold over the counter, from what I understand. You correct me if I'm wrong. It has some of the same benefits, from what I've read, of typical THC that you would think of. And I don't know that the downside or the side effects have been really elucidated, certainly not scientifically. Nobody can do a study on Delta 8. But from my understanding, it's some of the good benefits and some of the same side effects, and it's legal without it's legal. You don't need to go to a dispensary for it. In fact, I could be wrong. I don't think they sell it at dispensaries. I could be wrong.
They don't. They don't sell it at dispensaries, and from my research, it doesn't have a strong psychoactive effect like THC, but it can, with some people, especially in large doses, really cause some negative side effects.
Sure. Yeah, all I can say, not being an expert on Delta-8, is whenever you get something from an unregulated source, so if you go to the local smoke shop and Joe at the smoke shop is pushing Delta-8, I can tell you that you have no idea what's in there. There could be Delta-8, could be any kind of poisonous products. We don't recommend buying CBD at a less than reputable place without lab testing that could be provided. We don't recommend CBD, and certainly not the Delta-8. I tell patients, and it's not simply because I work here, that if you're going to put one of these substances in your body, if you're going to get CBD, get it from a reputable doctor's office or store where you can get a lab test result printed out and handed to you, or get it at our medical clinics. I'm not good at advertising for us at all, but a clinic like this has first-rate CBD, not Delta-8, but first-rate CBD, which has been lab tested, because the stuff you can get over the counter might be what it says, but generally isn't. It's sort of like getting vitamins. Half the time, it's not what it says it is, because the FDA has no role in regulating it.
Interesting.
Yeah.
Interesting.
Mm-hmm.
Let me see. So, doctor, tell us about the process of actually getting a medical marijuana card.
Yeah, yes, the way a patient can get it is they make an appointment at a medical marijuana doctor outpatient clinic, of which there's several in the state. You make an appointment, bring medical records, because that will absolutely prove that you have what you think you have. In other words, somebody might come in with cancer, and I generally can tell if they have it just by the medications they're on, but we always like records that just prove that they have what they say they have, and the state of Florida really wants us to gather some records. You don't need a whole raft of sheets of paper. You need, if they're there for neuropathy, which is tingling in the hands and feet and other things, if they have a doctor's note that says they have neuropathy on a doctor's letterhead or a hospital letterhead, that's all they really need. And then once they do that, they fill out paperwork, and then the doctor will interview them and do an examination of the patient. And then if we concur that they could benefit, and they have the records to prove that they can benefit, then we will help them finish up the registration. And it usually takes about 7 to 10 days to get a preliminary email, that's initial card, and then after that they can go to any dispensary they want in the state of Florida, and then a plastic card, which looks like a little driver's license with their picture on it, will follow and a mailing to their home address or post office. I think it's just home address. They can't send it to a post office box. And then they're legal. They can go to any dispensary they want to with that initial email about 10 days after they come in. They can get any products they want at the dispensary, or just what the doctor authorized. We, in our practice, tend to authorize all the various products, because a patient might tell us they just want to smoke, but the reality is they may see an interesting edible, and if we don't check it off, they can't buy it. So we try to be very fair to the patients so they can purchase what they want.
Interesting. Thank you very much, Dr. Auerbach,
Sure.
for this interview and explaining to our audience the medical benefits of cannabis and how to actually get a medical marijuana card. So if you have any interest, I'm going to have the website right here. You can click on them, follow them on Instagram, social media, Facebook. Thank you very much for watching, and we'll be back with more information very soon.
Okay, thank you.